Let's listen to an expert doctor for hypertension in young population along with coronary artery disease and higher heart rate. Can be sure of happy heart? Today we have Dr. Hemendra Pandey, consultant cardiologist, Kolkata. How do we define hypertension and when should we conclude that the person has hypertension?
Hypertension is a disease which is known as silent killer. So the thing is, to detect hypertension, you need periodic checkup of your blood pressure, particularly in people who are more than 40 years of age. A lot of definition of hypertension has been there. In general, it is accepted that systolic blood pressure of 130 and diastolic pressure of 80 is the ideal blood pressure, and 140/90 is a high blood pressure, and if it is more than 160 and 100, is said to be severe hypertension. The symptoms of hypertension are headache, dizziness, unsteadiness, and many times even when it gets detected for the first time, patient had a first episode of some mishap like paralysis or brain hemorrhage or a heart attack. So it's better to get it checked periodically, and particularly in people who have family history of high blood pressure, who are working in a highly stressful situation, and everyone more than 40 years of age, at least they should check their blood pressure every 6 months.
Can high blood pressure be completely cured?
High pressure is normally not completely cured. It can be controlled. In some special circumstances where high blood pressure is situational, like a person in stress or like in pregnancy, gestational blood pressure, or a situation which is called white collar hypertension, where when person goes to a doctor's chamber, his blood pressure goes high, but at home monitoring is normal. These blood pressure can be cured. Normally, blood pressure once detected is only be controlled, not cured. And of course, if a patient has erratic lifestyle, if he or she changes his or her lifestyle, like regular walking, loss of weight, and restriction of salt, regular sleeping habits, and some form of exercise, then in very few cases the blood pressure can be cured. But then it again comes back when these situations persist.
Has there been a recent increase in the incidence of hypertension and heart attack among young patients? If yes, what could be the underlying cause?
This is a very pertinent question in today's age. The incidence of high blood pressure and heart attack have definitely increased nowadays, and the principal cause being a stressful life. People have become so ambitious and competitive that they want to achieve everything in their life instantly. They don't want to wait for the success. So they have to work hard. They get a good salary in IT firms and other places, but they have to work equally hard, and the stress level is very high. So this is one of the reasons for high blood pressure and heart attack. And then, of course, the lifestyle is very important. They don't have regular sleeping hours. They work at night, sleep at daytime. They have a lot of junk food, which includes a lot of cheese, butter, and no exercises, no time for exercises. So these are the certain factors which are responsible for the increase of blood pressure and heart attack in young people. Of course, smoking is another factor which is important.
Thank you, doctor, for your time.